Welcome to our lesson on patient registration. The registration process is a crucial part of front desk operations in any dermatology practice. Ensuring that information is accurate and complete helps maintain efficient workflows, supports smooth billing and insurance verification, and ultimately improves the patient experience. In this lesson, we're going to cover the key components of patient registration. Let's begin with patient demographics. The first step in the registration process is collecting the patient's basic information. This includes their name, date of birth, and other identifiers, as well as their contact information. As straightforward as this sounds, there are a few important details to which we should pay very close attention. First, it's essential to enter the patient's name exactly as it appears on their insurance card to avoid any billing issues. If a patient has changed their name, such as after getting married, or if they simply provide a nickname, always cross-check that name with their insurance. Feel free to document any alternative or nicknames that they provide, but at least with respect to how they're entered in the computer. We generally want to err on the side of using their insurance name within the clinic's practice management system. Suffixes such as junior or senior, as well as titles such as doctor, can also be documented. At the very least, suffixes can help distinguish similarly named patients from one another. Titles are generally not as important with respect to billing, but some patients who have earned an MD or PhD are, shall we say, very eager to remind those around them that they should be referred to as doctor. But for most, it's a non-issue. Date of birth and identifiers. The date of birth is one of the most important identifiers, especially when you have patients who share common names. Cross-checking the date of birth against the patient's ID and insurance card can prevent mix-ups. Some practice management systems also allow you to take patient photos, further ensuring accurate identification. Another identifier is the Social Security number. In the past, the Social Security number was actually the primary identifier for distinguishing patients from one another. Fortunately, though, there's now less reliance on collecting the Social Security number from patients. The main push to move away from relying on Social Security numbers has to do with privacy concerns. But another reason is that you will occasionally come across patients who don't actually have a Social Security number. This is more common with non-US citizens, especially those who aren't working in the United States. This isn't to say that Social Security numbers are no longer requested, though, because many medical practices do still request this information during patient registration. But it's worth noting that some patients are reluctant to provide it, or simply can't, if they don't have one. This can create a unique situation, which is honestly handled differently from practice to practice. Although rare, some practices will flat out refuse to see patients who don't provide their Social Security number, while for other practices, it's just not a big deal. So check with your management team to learn about how your practice handles these situations. Contact information. Obviously, we need to know the best way to reach the patients themselves. Many practices also ask patients to confirm an emergency contact. Typically, this is a spouse, parent, or close relative. This contact should be someone who can be reached in case of an urgent medical situation. Let's move on to insurance information. Collecting accurate insurance details is one of the most critical aspects of patient registration, especially with respect to maintaining your practice's financial health. Patients are generally asked to present their physical insurance card, both front and back, at every visit. The information should, at the very least, include the name of the insurance carrier, the name of the insured, their identification number, the insurance group number, the payer ID, sometimes referred to as NEIC number, and the contact information for the insurance carrier. Just a reminder that we go over the significance of each of these items in greater detail in our insurance cards lesson. Some patients may have multiple insurance plans. Medicare-aged patients often have secondary or supplemental plans, such as Medigap, TRICARE for Life, or employer-sponsored coverage. Some Medicaid patients may have other insurances that should be billed first before Medicaid covers remaining costs. For those who do have more than one plan, it's essential to determine which is primary versus which is secondary. There are actually certain rules which are used to determine which of multiple insurances would be primary, secondary, or even tertiary. For example, for minor patients who have insurance coverage through both parents, the birthday rule may be used. With it, the parent whose birthday, month and day, falls earlier in the calendar year is considered the primary insurance. This can obviously get tricky, though, and is ultimately the responsibility of your practice's billing team to handle. But at the front desk, the best way to help is to simply ensure that you collect any and all insurance coverage details for each patient. The billing team should then be able to handle the rest. Now let's talk about consent forms and privacy practices. For minors, verifying the legal guardian is necessary. It's worth noting that only a legal guardian can consent to treatment. If a grandparent, babysitter, or sibling brings a minor, the practice must confirm that written authorization from the legal guardian has been provided before proceeding with the visit. This usually takes the form of written permission with a copy of the guardian's ID.